Hi, I'm Alan Dow, a physician at VCU Health, and I'm here today with a physician from pulmonary critical care, Michael LaRue. Michael, hello.
Hey, how's it going?
And we're here to talk about some of the symptoms that patients may be experiencing and how to think about them in terms of risk with the COVID-19 epidemic. So, Michael, in your experience, what are some of the things that are more worrisome in terms of symptoms for patients to have?
So I would say the most concerning ones, when you look at patients that have gotten really sick and ended up in intensive care, it's usually people that have respiratory failure. And what that means is that their lungs fail. And usually the early symptoms of that would be shortness of breath. And sometimes people can even have passing out because their oxygen levels are so low.
So things like fever, muscle aches, sore throats, are you less worried about those symptoms?
Certainly concerning symptoms for a potential infection, but not usually life-threatening.
Okay, so if someone has passing out or shortness of breath, they should be more worried. Do those things tend to get sicker faster then?
So in COVID, it seems like people tend to get sick pretty fast. And so sometimes the shortness of breath can be a pretty late finding. And so people that have shortness of breath as a symptom should really get checked out sooner rather than later, especially if they have underlying medical conditions.
So are there certain conditions that you should be worried about having COVID infection?
Yeah, so there are some risk factors with people that are going to get sicker. So one would be older age, another one would be high blood pressure, diabetes, and then the other ones would be people with existing lung problems like asthma or COPD.
Great. Okay. So what should those people be doing now to help prevent them from getting COVID in the first place?
Yeah, so I think the most important thing is going to be prevention. So maintaining the social distancing when they do have to go out in public to do things like going to the pharmacy, going to the grocery store, making sure they're washing their hands, using hand sanitizer, wiping down the carts at the grocery store, and even considering wearing something like a bandana or something over their face to try to prevent themselves from getting sick.
Okay. Okay. And it sounds like you've given us good advice if they have any of these symptoms like shortness of breath and passing out, that they need to really seek medical attention very, very quickly.
Yep, that's actually absolutely correct. So some can get sick really fast, and so if you start to develop those symptoms, you should get checked out really quickly and start treatment if it turns out that you are sick.
Great. Well, thank you for joining us.
Thank you.